Hi, my name is Stephanie John, licensed marriage and family therapist and mom of two. And I'm thinking about starting a series called What I Wish I Knew Before Becoming a Mom, Marriage and Family Therapist series. Little thing. So, the first installment of this series is going over language that I often hear misused before and even after my pregnancy with my girls. So, first word of the day is postpartum. I've seen this word postpartum used. I think generally speaking, we know postpartum has to deal with pregnancy. However, postpartum, oftentimes when I'm hearing it misused, is referred to some level of a mood disorder, right? So I kind of wanted to go over what actually is postpartum and said mood disorders and list out some of the possible mood disorders someone can experience during that time period. So, first things first, postpartum is the time period after having a baby. About a year after having a baby is considered someone's postpartum period. So, postpartum literally is a time frame. That's it. That's all that really is. Now, in a case of what I'm hearing from most people is that postpartum insert said mood disorders are usually the thing that they're trying to get at. And most of us usually hear maybe one of two. So I decided to create a little list of possible mood disorders that women possibly can experience during that time frame. So we have postpartum anxiety, postpartum depression, postpartum OCD, postpartum bipolar disorder, postpartum psychosis, postpartum panic disorder, just to name a few. And with that being said, having these disorders and having the word postpartum in front of it just gives practitioners and even your family, friends, community insight as to what the onset or when the onset was of you having said mood disorders. So postpartum anxiety just means I've started to experience anxiety after having birth, give or take, after 2 weeks of having my baby. That's all that means, right? Postpartum depression. I started to experience depression symptoms about 2 weeks after having my baby, give or take, right? So that's basically what that means. And before having my kids, I didn't know, one, that all these different mental disorders was even a possibility. So, I decided to let someone else know, let the community know of some of the things that they could look out for during that time frame. And if you are experiencing anything that feels close to any of the disorders that we just mentioned, reach out to your medical provider, your OBG, or nurse practitioner, or your mental health practitioner if you need any support.